Good afternoon, everyone. Thank you so much for joining us for our Facebook Live event today on COVID-19 stress, mental health, and well-being. I'm Jeff Blake with Blue Shield of California Communications, and I'm going to be joined today by two wonderful guests. The first is going to be Bryce Williams. He's our VP for Mind-Body Medicine at Blue Shield of California. And shortly, we'll also be joined by Dr. Ruth White PhD, who's done a lot of research on stress management and is a faculty member at USC School of Social Work. So first, I'd like to welcome to the program our Vice President for Mind-Body Medicine, Mr. Bryce Williams. Let's see if we can get Bryce on the screen. Let's see. I don't hear you, Bryce. Can you say hello if you're on there? You know what? I think we'll come back to Bryce shortly. Let's switch the order and start with, I'll introduce Dr. Ruth White, PhD. She is a longtime social worker and also is now a clinical professor at USC School of Social Work. Dr. White, can you hear me?
Yes, I can, Jeff. Can you hear me?
So I'm having a hard time seeing you, though, but I can hear you a little bit.
Oh, that's interesting.
So let's see, maybe we can get a photo up of you for now, or we may, if we're still having technical difficulties. Okay.
Yeah, I can see you. I can see you in the corner.
So Dr. White, I wanted to see if you could help us make the connection here. Why are people struggling so much right now with this? I know for myself, my family, we're physically healthy, but we're really feeling the stress and anxiety of this. And I'm wondering if you can help us make the connection between our mental health and our overall, or our physical well-being.
Well, I like to remind people that your brain is part of your body, right? And so the same chemicals that are, creating a sense of fear and dread in your brain is also impacting your body. And the CDC has a page now around COVID-19. And one of the things they talk about is different reasons for stress during an outbreak of any kind. And one is fear and worry about your health. And what is important to note is that the stress hormones that we feel in our body, whether it's the adrenaline rush or the pain that we feel in the gut when we feel stressed, or the headache, or any of those things, is from the interaction of the stress hormones like adrenaline and cortisol on our organs. And so, if you have an acute stress moment where, I don't know, your kid's jumping off a table, or a car is coming, that is the adrenaline rush, which, gets you stronger and more alert. But if that stress is maintained over a long period of time, what happens is the stress hormones like cortisol flood your body. There's nowhere for them to go. And then they build up and there's some kind of toxicity. So, there's changes in our sleep, worsening of chronic health issues if we already have them. And then sometimes people react with, using alcohol or drugs. And that's because, again, the level of discomfort that we're feeling. And sometimes, we're talking about things like hypertension come from stress. You can have heart disease from stress. And this has to do with the impact that cortisol has on things like our arteries.
So, Dr. White, I heard most of what you said, but it sounds like, I guess the good news is that, it's normal to be feeling heightened anxiety during a true crisis. And that's sort of how our bodies are, telling us that we need additional support, or that there is something that we need to be focused on. So maybe that gives people some comfort to know that it is a normal response that your body has.
Do you hear me better now, perhaps, on my mic? Yes. And so, it is normal to feel stressed out. It'd be abnormal if under all these circumstances, we wouldn't be feeling any stress, whether it's from the change in our schedule, having everybody at home, or if you're like me, you're living alone right now, and it's just hard to not have people to interact with. So there was a Kaiser Family Foundation study. They've been tracking people's reaction to COVID-19. And in their April 24 report, they showed that 42% of people had a loss of job or income or hours. 40% of people had trouble sleeping, and 45% of people reported a negative effect on their mental health. That's a lot of people. And
Yeah.
so, and it's been increasing over time. And so, that says to everybody that you're normal if you're reacting this way, but there are things that
Yeah.
we can do about it.
I know that you are a professor in social work, and I know you have a lot of colleagues who are, professionals in the field, seeing their clients, their patients remotely. Have they shared anything with you about how people are dealing with this, or what kinds of support people are asking for?
Yes, there's a lot of anxiety. People have a lot of fear, and the anxiety level is very hard to manage. And it's really hard sometimes right now, because what I'm hearing from my students who are in the field and from my colleagues is that, for example, not a lot of people have a setup, right, that can get them remote access to telehealth. And so that's been an adaptation for a lot of people. If you are serving low income clients who don't have access to the internet, who don't have, video on a laptop, it's making it hard for people to access their mental health services. There's also been, I think it was Mental Health America, one of these organizations that have reported increased activity on their warm lines. So people calling in for mental health support, it has increased in the last month. The fact that people are calling in more.
Yeah, thank you. I'm going to actually also ask the people who are watching, if you have questions, we're going to take them live too, so we can see your comments as they come in. So if you have questions for Dr. White, and we're going to try to bring Bryce back in a moment, but I have a couple other questions just that I'm curious about while we're one-on-one with you, Dr. White. I think one of the things that people are struggling with now is the lack of physical closeness. I think we're doing a pretty good job, I think a lot of us, of trying to connect using the phone, using video chats. Is there something about physical closeness and actual human touch that is correlated to positive mental health?
Yes, well, what we call the hug hormone, oxytocin, actually gets released when we hug people. It gives us that warm and fuzzy feeling when we connect with people we love, and it makes us feel, literally, it's that warm and fuzzy feeling. You feel happy, you feel joy, and we're lacking that right now. That sort of feel good. You can still, yes, you can connect over the internet, but it is not a replacement. It is a social support for sure, but it's not a replacement to human touch. We're social beings. We need that interaction with each other. And that's why it feels good when we connect with each other physically, when we snuggle up to somebody that we love, etc., or hold somebody's hand during a moment. I mean, a lot of people right now are struggling with the fact that if they do have someone who is ill in their family, that they cannot be there to hold that person's hand and provide in-person support. Because even if you're talking over the phone, if I'm in a hospital bed or if I'm sick at home and quarantined, it's not the same to be on the phone. I mean, you really want that interpersonal connection that we normally have. And so that isolation, physical isolation, is very difficult for us.
Yeah. We have it's coming up on the screen now. We have a question that just came in from Jose. Thank you, Jose, for your question. Any suggestions for people who live by themselves? I guess now, let's maybe talk a bit about, tactically, what are some concrete steps people can take to try to maintain their mental health during this really trying time?
Well, I normally have a roommate, and she went home to stay with her father, who just lost his wife a few weeks ago. Her mom died. And so she left because he was going to be alone. And now I'm living alone, and I've been living alone for 2 weeks. And so I've been feeling the impact of that. And I think it's really important to schedule connecting time. And I said, a schedule is really important right now because it gives us a sense of stability. So even if you're by yourself, set out time for when you're going to eat, when you're going to work, taking breaks, exercise. I tell people mindfulness is really important right now in being able to calm ourselves and our bodies and to give us a sense of calm and centering ourselves. A gratitude practice is very important for feeling hope and optimism so that we're not focused on the negative. I also say to really restrict, to have a media diet, limit yourself to one source or two sources of information. Limit the amount you consume. So maybe you say, you know, you're going to have 15 minutes in the morning, um, in the um, in the evening, and so that is one way to control the amount of negative input that you're having. And then if you do watch the news, counteract that with, I don't know, 15 minutes of comedy or something like that, something that is lighthearted, so that you have some kind of lightness and not just go down this rabbit hole of doom and
Yeah.
gloom.
Yeah. Thank you so much. That's a great question, Jose. And we have another one that just came in from Maria. How can we help seniors and elderly parents take this threat seriously without causing them to be anxious? I mean, that's a really question a lot of us are dealing with now. Is you want people to take it seriously, but you don't want them to develop, an anxiety disorder over trying to keep themselves safe. How do you find that balance?
Yeah, I think, and it really depends on the person on the other side. So I have elderly parents who are in their 80s and they live in Jamaica, and they've been told now they cannot leave their house. Like, you know, people are going to report them if they do. And so it was hard for my dad because he had a routine of getting up every morning and going and getting a newspaper. And I had to tell him, no, Dad, you have to stay at home. And so, so far my parents have managed it well. You know, they're like, okay, I'm home for my health and this is why I'm here. And if they understand, and again, if they're living alone, that's really, really hard for them. But if they're not and they do have company, then at least if they can get the understanding that, you know, they are at high risk, but if they stay home, they can be healthy. So that staying home is not a negative, but staying home becomes a positive thing. Like how you would say you're exercising, or mom and dad, you're eating right. This is what you have to do right now for your health. And so it's, instead of saying you could die, say this is how you can take care of yourself. And so then it has a positive spin instead of a negative one.
Yeah, very good. Thank you. That's a good way to look at it too. We have another question coming in, and I want to after that see if we can check back in on Bryce and see if he's able to join us. But this is from Yanad. The question is, how can you create a safe space to share with an employer that you're having a hard time and needing mental wellness? Oh, I see. That's a really good question. But how would you recommend somebody let their employer know this is a really challenging time for me? Maybe I need some flexibility.
Yes, and I think a lot of employers are trying to respond to the stress of this moment. I've gotten several requests for doing stress management workshops online. I have two later this week, one with a big tech company and one with a nonprofit. So I think organizations do understand what the situation is. But what I would suggest is that you schedule a one-on-one appointment with a supervisor, whoever is your immediate supervisor. Tell them exactly what the concern is. So if it's, you know, I have my children at home, it is very hard for me to work, or I'm feeling really lonely, or, you know, I would like some flexibility so that I can work around my kids' schedule, whatever it is. And a lot of organizations have employee assistance programs that give them access to mental health services. So if your organization provides access to mental health services, avail yourself of those resources. Call whatever number that you have to call, or email the contact information, but also talk to your direct supervisor. Or if you think that might not work out, to call HR and let them know that you're having a challenging time. I don't think that's going to be hard for people to understand right now. And the workshops that I've been given are oversubscribed. I mean, I have more than a few hundred people that I'm going to be doing a workshop for at one company on Thursday. So I think companies are aware that this is a hard time for everyone. And so I think they're sensitive to that right now.
I mean, if there was ever a time for you to have that discussion with your employer, a global pandemic might be, might make sense. I think we do have Bryce waiting to come back in the feed. Let's see if we can bring Bryce back into the conversation. Let's see. Bryce, are you coming in? I don't see you on my end, but...
No, I don't see him either.
Right, we'll keep trying. All right. We do have a couple other questions coming in as well. Let's see. Let's see. We have a question here from Robert. What suggestions do you have for overcoming some of the negative stigma around mental health some groups may feel that prevent them from seeking help? I know this is an area where you've done a lot of research, Dr. White. So
Yes.
what can you tell us about addressing stigma?
Yeah, I think it's important to normalize mental
Seems
health.
like we're having COVID.
Oh, yeah, it's in terms of normalizing the struggles that people are having right now. It's important to say that this is a human reaction, that mental health, like I always say, mental health is health. And so, you know, your mind and your body are connected, they're not separate things. And that, you know, if we have certain kinds of inputs, you know, just like we have cancer or we have diabetes, we can have anxiety, we can have depression or other mental health issues. I, for one, have bipolar disorder and I'm open about it. And I've done activism around destigmatizing the labels that people feel marginalize them, especially at work. And so I don't suggest that everybody, you know, is open with everyone, because some people are not as receptive as others. But to share mental health struggles normalizes that, because if you share them, what you're going to find often is that other people will share back with you that they too have various struggles. And so having those conversations normalizes our mental health, because then people are connecting. Once you keep it a secret, you think that you're the only one that's going through that, but you're not. You're not. And I think that's what's important to note, is that there are a lot of people who have these struggles. And right now, there are a lot of people like, you know, tough people that we see like Jay-Z, Common, all of these sort of, you know, men that have this reputation for being, you know, masculine men and tough men, who are talking about going to therapy. And I think it's important that we have role models in the public sphere that do go and take control of their mental health.
Thank you so much for that. We do have another question that just came in. This is from Vlad. What are some tips for parents who have to work and homeschool? I know that's a situation for me in my house. We have a 4-year-old,
Mm-hmm.
and she's ready to go back to school, but here
Mm-hmm.
we are. So it is definitely tough. I can say from my own experience, trying to work full time and take care of our families. Are you hearing that from colleagues or from other people in your life? And what advice do you
Yeah.
have for
I
us?
mean, a lot of people are having this struggle. And my sister and I actually did a YouTube video that's up on my YouTube channel about this. My sister is a parenting educator. And one of the things she suggested was to develop a schedule that's parallel to your kid's schedule. So, you know, if your kid takes a nap, that's probably the time you want to schedule a meeting with someone. If you need a really quiet time, that's the time to say, okay, they're going to watch a movie. So line up a schedule so that the kids know what to expect and you know what to expect. I also suggest, you know, some quiet time together so that the kid also has a place where they're also quiet. Whether it's taking 5 minutes to do, you know, some meditation, to sit down. I remember when my kid was in preschool, she had a teacher who would do yoga poses with them when she was like 2 or 3, you know, and they loved it. And she did it before they took a nap. So it's really important to engage your children in your schedule, and developing a norm, a routine is really important for kids in terms of stability through their lives and making them feel safe. Also, I think it's important to do things together, right? So things like playing games or a puzzle, to take that time during the day to connect with your child so that they're not seeking attention when you're trying to have a meeting. And so if you're able to give them one-on-one time, schedule some quiet time, give them some time to do homework, etc., having that routine is really, really important for families right now. That
Yeah.
doesn't say that, of course, all is going to go well, but that's the best case scenario.
Yeah. And it goes back to what the previous commenter said too about getting flexibility from your employer. That can
Mm-hmm.
also be really helpful.
Mm-hmm.
And I'll just say one thing too with young people that, at Blue Shield, we have, a high emphasis on youth mental health.
Mm-hmm.
And we realize that as much as adults feel like our lives are out of control right now, for young people, they already have so much less control, and it's that
Yes.
much more stressful for them. So we
Yes.
got to make sure we're giving our kids and young people a lot of support and compassion.
Yes, and it's
We have
important.
another question that
Oh,
just came
sorry,
in,
go ahead.
and I do have an update. So I think we're going to have Bryce come in another time. We weren't able to work out the technical difficulties today, unfortunately. But Dr. White, we're so glad that we have you on. This next question comes from Lee, and the question is, what can we do for young people in our communities? Aside from breakfast lunch programs, any resources to share to get them motivated and promote mental health and safety? It's a great question.
Oh, that is a great question. I don't have any immediate resources in terms of like a number or something to give out, but I think what is great is to engage youth in working on some of the issues in the community. So if you can get them to do wellness checks on older people, help people run errands that they can't run because they're isolated. So give them something actively to do that gives them a purpose. You know, it's like, okay, every Wednesday at 3, I'm going to check in with Mrs. So-and-so. I'm going to do these groceries. I'm going to mow somebody's lawn. I mean, one of the things I'm noticing is just grass is growing like crazy all over the place because there's not a lot of maintenance. Like even around the lake, it's just, you know, everything's going to seed. So, you know, whether it's picking lemons off, because lemons are really like everywhere right now in Oakland, falling off trees as well. So if you give them something concrete to do, aside from just chores, if they can contribute in some way, giving blood is another way that people can contribute right now because there's a shortage actually of blood products. I have a friend who gets regular transfusions, and at one point they were thinking that he might not be able to get his transfusion. He has sickle cell. And so I've been encouraging people to go out and give blood because a lot of people are not doing that kind of thing right now because everybody's at home. So yeah, and I think if they have, or, you know, sweeping the drive, whatever it is, to give them something concrete to do that is linked to, you know, helping others, and they will feel good about it. It also gives them, you know, a sense of control over their life and the positive feelings that come from helping other people.
Yeah, and I will add one resource too, and maybe we can somehow put it in the comments for people or somehow share it. But Blue Shield is working with DoSomething.org, which is, you know, maybe the worldwide leader in youth engagement online. And they've announced something just last week called New State of Mind, and it's where young people from around the country, around the world, can share what they're doing to deal with this, you know, total change of their lives. And I think we had like 11,000 different young people contributing their like experiences and sharing with each other. So it's kind of a cool thing. So maybe we can share that link. Yeah. We have another question from Jose. People say I'm a type A personality. I try to control things and everything feels out of my control right now. Any tips for people like me? That's I like this, a specific kind of a question. If you feel like you are a person who really needs to have a lot of control, maybe this situation feels even more, you know, devastating. What advice might you have?
I think it's more about controlling what you can, because there are things that you can control right now. Again, I would go back to having a schedule and a routine so that, you know when you're going to do things, what's going to happen. Don't do the random phone calling. If you're somebody, you know, like a type A, you know, I'm going to call mom at 2 p.m. Monday, Tuesday, Wednesday, Thursday, Friday. On Saturday, I'm going to call her at 4 or whatever it is. That's really important. I also say you have control over your body. And so the stress that builds up, I tell people, you know, do some jumping jacks, skipping. I mean, if you don't have like a bicycle or whatever at home, find a way to move, you know, put on some music and dance, but burn off that sort of extra tension that's coming from feeling out of control. Also, this is the person that needs to do some mindfulness. And whether that is meditation, some yoga, listening to a meditation on platforms like Calm. A lot of these platforms are now free. I think Calm decided that they were going to be free during the COVID-19 crisis. So, you know, you can listen to a book or calming sounds, but some way to like feel centered and, you know, grounded. But I also think burning off that excess energy is also important. But also really a schedule is one way for a type A person. Focus on something, you know, get creative. One of the other things I'm suggesting for people is if you paint or you write, you knit, you crochet, whatever it is, now's the time to express that. You know, cooking. A lot of people, I don't know if everybody's noticing, but there's all these cooking, everybody's baking things and sharing on Facebook or on different platforms. And I think that's another way that people are feeling like, oh, I can be creative, I can express myself, I feel a sense of control, look at what I'm doing. And there's some feeling of productivity right? That you're actually doing something while we're
Yeah.
locked up at home. Learn a skill. I don't know, learn a language. I know several people right now actually who are learning a foreign language, and they're finding it really a great way to feel like they're getting something done and that they'll come out with a new skill. I have friends who are planning to go on trips and they're like, you know what? I'm going to learn the language so that when I get there, I can actually communicate. But yeah, if you find ways to be productive, then that really helps a type A person.
Yeah. I like that thinking about it as creativity providing you a sense of control. I don't
Mm-hmm.
think I ever thought connecting the two, but it really makes a lot of sense to give your mind something that you can really focus on that's healthy and that helps you kind of decompress from all the things we
Mm-hmm.
don't have control over.
Yeah,
So I
it's a
think we have time for
distraction.
maybe one or two more questions. I think we have one here, another one from Maria, and I think we can answer this one specifically and maybe also a little more broadly. The
Mm-hmm.
question is, how important is it to get exercise and get outside? Maybe you could also share any of your research or your experience in how do we connect the mind and the body? What is it about exercise and movement that helps preserve or helps enhance your mental well-being, and vice versa? How does having your well-being negatively impacted, how does that affect your body and your overall wellness?
Yes. Well, so I am one of these people that go outside and, excuse me, work out. I live here in Oakland and I walk Lake Merritt most days. So what the research says is that exercise outside actually has really powerful mental health benefits more so than even exercising inside. They theorize that it has to do with things like vitamin D. So you need the sun to produce vitamin D, and vitamin D is a mood regulator. So if you have low levels of vitamin D, you actually will have poorer mood. So that's a connection between the physical and the mental health, right? And so even if all you're doing is going on a porch or a balcony, a backyard, a front yard, whatever it is, if you can take your exercise outside, whatever that is, yoga, like I said, skipping. I've been suggesting jumping jacks because you don't need equipment for jumping jacks. You need, your body, and it will burn. When we say we burn off energy is because there's oftentimes a buildup with stress of things like adrenaline and the cortisol. And what you're doing is you're getting rid of because cortisol also releases sugar and fat into the bloodstream, and so you're using that and you're burning it off, which actually improves your health as well. So exercise calms you down. You also have endorphins that get released when you exercise, and endorphins are a pleasure hormone. So exercise will connect with the places where you think of sex and food, is the same center for of the pleasure that you get, which is why people talk about things like runner's high. That's a good feeling that you get from exercise. So exercise is really important right now, and it's also good for your body to feel strength, for your immune system, because also good mood and exercise improve your immune system. And right now we need to have strong immune systems to fight off whatever we're going to be exposed to right now.
Yeah. So it provides a immediate relief and a protective factor. It's
Yes.
kind of a lot of benefits. Um, so, Dr. White, I just want to say we really appreciate you joining us today and sharing your
Thank you
experience,
for
some of your
having me.
research and data. I think for me, that one of the great takeaways is that it's very normal to be
Mhm.
experiencing higher stress and anxiety right now.
Yes.
And, there are things that we can do for
Mhm.
self-care. And beyond
Mhm.
that, if we need more, it's very normal to seek help and ask
Yeah.
for support from mental health professionals, from your doctor. So even though the situation is very serious that we're all facing, there's still things that we can do to take care of ourselves, take care of each other, and then we can seek help, when we need extra support.
Mhm.
Anything else you would like to leave us with? Anything, one
Yeah.
last thing you would hope people can take away from this or
Yeah.
keep in mind?
I thought I had a number right here. There's a distress number from the CDC that I had somewhere, and I'm not sure where it went. Yes. So the CDC has a disaster distress helpline, and it's 1-800-985-5990. And that's the CDC disaster distress helpline. Well, it's actually run through SAMHSA, which is the Substance Abuse and Mental Health Services Agency in the government. You can also text talk with us to 66746. So if you're struggling and you don't have any
Wonderful.
other resource, so 1-800-985-5990. That's the disaster distress helpline.
Very good. All right, Dr. White, thank you so much for spending your time with us
Thanks for
today,
having me.
for sharing those insights. And thank you all to everybody who signed in and who provided those great questions. We will hope to do more of these as we go on and continue sharing information and bringing in the experts who can help us all get through this together and give us information that we need to live a more healthy life and maintain our mental health and well-being. Thank you all. Stay safe, and we'll see you next time.